Hey guys, welcome to the Bloom channel. My name is Danielle. I am your host. And in this episode of the Bloom channel, we're going to go over and review some basics of health. This video is for you if you are looking for a whole person, integrative view of the healthcare system and to health and healing. So I am again your host, Danielle, and I have been a registered nurse for nearly 2 decades. Most of my career has been spent working with people to stay out of the hospital and stay as healthy as possible. So with that being said, some of the things that I have found and discovered over interviewing thousands of people and working with them, that there are some common themes that I see in which are barriers to having optimal health and with the healthcare system in general. So this episode again is going to go over some very important but basic health viewpoints, and just again, this is my coming from my experience in trying to keep people happy and healthy and out of the hospital. So first of all, I want to say that I know it's very difficult to navigate the healthcare system, navigate this world. We are definitely in some unprecedented times. We have everything is digital. We have information right at the tips of our hands, generally from an iPhone, laptop. So with that has really increased people's ability to learn about their health, and has brought about a lot of good things. So there are many apps and things like that that are available now as opposed to 10 to 20 years ago, that allow us to have a greater understanding of our bodies, our health, and to track those. So one of the main things is to establish primary care. Have a primary care, either a physician or a nurse practitioner, but to have someone that you can trust, that you can talk to your friends and family if you're unsure where to start. Oftentimes, you can contact your insurance company and they will tell you who is in network. If you do not have health insurance, which many people do not, then generally you will have a local primary care office that is based on income, like a family health center. So those are wonderful, wonderful places to establish primary care. So have a primary care physician, and what they will do when you go into the office is they will ask you many health questions, especially about any symptoms you're having, and just in general, they want to know about your health and get so that they can get the best picture that they can of how to serve you. Oftentimes people have not established primary care, and then they don't know that they have a situation, a disease, an illness going on, or they haven't established primary care and have no idea how to take care of their bodies, or if they're having a healthy weight. Some things that you'll review with your healthcare provider, your primary care, is they will take your vital signs along with taking your temperature. They will take your respirations, and this kind of indicates if you're having difficulty breathing. They will also take your blood pressure, which is very key. One of the most key things to that gives light as how your health is being managed, as heart disease is one of the number one causes of death, and has continued to be over the past couple of decades, but it still is. So knowing your blood pressure and having a healthy blood pressure is key to having a less health problems down the road. Blood pressure has a top number and a bottom number. The top number is called systolic. The bottom number is diastolic. and we can go into more detail in later episodes if that is something that you would, you guys like to hear about. But primarily I wanted to address some of the physiological things that are important to manage your health, along with, in later episodes, we'll talk about, mental health, emotional health, and other integrative and holistic approaches to health. But first things first. So they will also check your heart rate, and this is also called your pulse. So you may have heard it, in both ways, pulse, heart rate. They are the same thing. They are the number of beats per minute that your heart beats. And this will vary based on, if you're at rest or if you're at exercise, doing activity. So they will also, again, look at your heart rate, and this is a good, indicator of if you're having, good health and if there are any problems. So with your heart, again, they're gonna look at your blood pressure, they're gonna look at your heart rate, they're also gonna listen to your heart and see if it is having, if there are any abnormal beats or if it's, sounds right. They will also check your labs. They will look at your A1C, which is a good indicator of how well your body is managing, blood sugars. So they will look at that, and the A1C is a kind of a composite of the last 3 months of how your blood sugar is doing. If you have an A1C that is, higher, above, 6, 7, 8, 9, and so on, this could be an indication that you have some diabetes going on, or pre-diabetic, or, it can tell how well your diabetes, or blood sugars are being controlled. This will help see, if you need any medications or have any changes in your diet, along with your stress level. Stress is a major factor in all areas of your health and in all aspects of, your labs and your numbers and things like that. So stress can increase inflammation within your body, which then can raise your blood pressure, raise your blood sugar, and things like that. So they were also going to look at your electrolytes in your body. They will look at, calcium levels and things like that. Will tell how, if you're deficient, if you may need some supplements. Vitamin D is a critical lab that they will look at, and this tells if you have enough vitamin D. Lack of vitamin D can cause many different symptoms, such as even depression, and overall functions of your body. So again, they will look at, vitamin D levels, calcium levels. They will also look at if you have any infection going on. So they would look at your white blood cells, and this is a good indicator of letting them know if there's some active infection going on in your body. As the numbers raise and get higher, then again, it could be an indicator that something is going on and needs an attention in your body. They will also look at your cholesterol, and it seems like pretty much everyone that's living at this time, that's an adult, may have some elevated cholesterol levels. So the cholesterol level in the blood, they will look at, and if it's elevated, of course, there's different types of cholesterol. You have good cholesterol and bad cholesterol. If your bad cholesterol numbers are elevated and high, then they will likely have a conversation with you about if you want to start on some, cholesterol medicine. They would also talk to you about your diet, and if you are eating a lot of, fatty foods that are, high in saturated fat, then this definitely could impact your cholesterol levels. If you are, and this is just a good tip overall around, unless you have really specific chronic disease processes going on, is to adopt a heart healthy diet, which is low in saturated fat and low in cholesterol. So more whole foods, things that are as close to the natural source as possible, whole, fruits, vegetables, lean meats, things that are not bacon, which I do love bacon, and lunch meats, things like that, hot dogs, bologna, which are, have been established as, kind of like an all-American food. Hot dogs are, at cookouts and family occasions and baseball games and sporting events. So, and I do like a hot dog occasionally, but try to stay away from those types of foods as much as possible and integrate, more high fiber foods. These would be things like vegetables and fruits, again, that have, high fiber in them to help reduce the cholesterol. So again, these are general, health management, health promotion tips and things to address, as, like I said, most people, and I've interviewed people in the homes, outside of the homes, and most people are very detached from any of that and may not have had that education or information anytime before, especially if they have not had primary care or seen anyone. And people can literally be in a shock when they're in the hospital and having these conversations for the first time with any type of, nurse or healthcare provider. It can be overwhelming. So the goal is to kind of help prevent prevent people from going into the hospital, from that being, the point in the place where things kind of got bad. We want to curb that and prevent, these types of things. And it is a process. It is a journey. You don't have to be a healthcare professional to, have access to this information. So going back to the primary care visit, this is a place, your primary care provider is someone that you can talk to about your diet. They will ask you about your activity level. Do you live mostly a lifestyle of where you maybe you go to work, you run around with the kids, and then you spend most of your evening, watching TV or on the couch, or just don't get a whole lot of, movement at all. These factors, play a big important role in your health management. They will also talk to you about your stress level, which, to be honest, let's face it, most people today are, their stress level is up to here because of the world that we are living in right now, and it is difficult to navigate just whether or not something is truth or something is not, on social media and places like that, or the news, and just worrying about the everyday things that are going on in our current world. So those can be, cause stress, along with things that are going on, job loss, sickness, having a family member that has become ill, having to, be a caretaker for children, as well as elderly parents, as well as, possibly yourself. So there can be definitely a lot of stressors that can impact your health. So the goal of this channel is really to help navigate some of that and give you some tips and to really help you bloom. And it's not just one aspect. It's not just the physical self. It's not just the labs. It's not just the vital signs. It's not just having, the right medical providers and specialists. It's having the right support to navigate through this journey. Because I do encourage everyone to have, counseling, have, support in that area, as we can just all, use it. I've never met anyone that says, you know, I'm just really, really good and I don't need, you know, support or help from anyone. So the road is, can be, you know, bumpy, but you can get through it. And please stay tuned if you want to learn more about how to, you know, look at your health from a whole person, integrative perspective. And we will get into more episodes where we talk about, you know, energy and, you know, how to, you know, improve your health, avoid toxic relationships, and to have really ultimately a great relationship with yourself, because that is where it all starts. So thank you for being here. Thank you if you have watched this video to the end. Please like, comment, and definitely subscribe to stay tuned. Again, my name is Danielle, and I'm the host of the Bloom channel, and I am here for you to help you navigate your health. Thank you.